Welcome to the Goddesses of Social Work podcast, hosted by Renita Davis, licensed clinical social worker, board-approved social work clinical supervisor, and facilitator of the Goddesses of Social Work supervision community. Join us as we travel through the social work journeys told by the Goddesses of Social Work community members, past and present, as they make their way toward clinical licensure.
Welcome to the Goddesses of Social Work podcast. In today's episode, Brittany Vittor, LMSW, has graced us with her beautiful presence. Brittany Vittor, LMSW, graduated from the University of Alabama in 2017 with a Bachelor's of Arts in Psychology with a minor in Human Development and Family Studies. After moving to New York in 2019 and taking a position as a behavior intervention specialist, Brittany was accepted into Stony Brook University Graduate School of Social Welfare program. Brittany studied social work with an integrated health specialty. She then completed her student internship with the local libraries and at Long Island Community Hospital. After graduating in 2021, Brittany moved back to Alabama, had a baby, and got married. Brittany accepted her first fully licensed position as a mental health professional with Alabama Department of Corrections, working within several prisons across the state, moving on then to Blue Cross Blue Shield, Alabama Psychiatry, a regional hospital in the emergency department, and now Brittany works with AMN Healthcare as a travel social worker on her first assignment in Delaware. Brittany is just doing her thing to get ready to test for the clinical license. Brittany's experience has given her a chance to understand how versatile a social work license really can be. Welcome back, Brittany. Super excited to have you on the show again today.
Thank you. Yes, thank you for having me back. I'm very excited.
Yay. The motivation behind this year's social work theme proposed by the NASW, Empowering Social Workers, Inspiring Action, Leading Change, states that social workers need support to meet the high demand for their vital work and should get higher pay. Brittany, what has been your experience with the salary gap within the social work profession? Have you had any experience having to negotiate your salary? If so, what has that been like for you? Or if not, what advice can you give other social workers who may be struggling with salary negotiation?
Okay, yes. So when I hear the salary gap in social work, it makes me think about how there are some positions that are like, we require a licensed master social worker. And then you'll see the posting is like $15 an hour, where there might be a position at a similar business wanting a licensed master social worker, and they're offering, a salary of $75,000 a year. So when I think of the gap, it just makes me think, I guess some companies know what they need, but they're not willing to ask for that, like at the market value. They're just kind of making up their own, this is what we'll pay you. Um, so that's unfortunate. So that's what I think of when I hear salary gap. As far as negotiating a salary, I have had to do that. It is a very difficult topic. It definitely makes me nervous to think about it. I do a lot of research before I go on interviews. I like to try to see what other people in the position are making, like Glassdoor and Indeed are really good websites to look up your position. And sometimes if they don't have like your exact position within that company, it's good to look at what similar workers are making. So like, and I work in hospitals, so I look at what the nurses are making. There are a lot of nurses that work, in the field of case management. So I kind of like to see what that budget is and go into it with an idea of this is what I would want to make with this company. On an interview, if they ask you what you're looking to make and you don't feel confident, like knowing what you want to ask for, you could ask what the appropriated range is that this position goes for. They'll usually give you a range, and then you just negotiate like, well, this is what I'm bringing to your company. These are my strong points. I have all the experience listed in your post, so I see myself at the high end of that range. I've definitely been offered positions before that I've been like shocked at what they've offered me. And they'll usually say, like, well, you're at the beginning, you're new. I'm like, at the beginning, where? Because I have a master's degree. I got my license. I've been in supervision. I've worked at 45 different places since I got my license. So I'll usually say, this is what I'm willing to accept from that point. And I've usually had a good outcome from that. There was one time when I didn't, and I didn't accept that job. And I let them know, like, that's not a salary that I could live off of. So I'm not going to be accepting this position at this time. Um, so yeah, if they really want you and you say that, then they'll meet you back with a good offer.
And Brittany, that is so empowering. Thank you for that. And that was really you just taught a 101 class on salary negotiation. I was like, oh, that was so good. I'm wondering a couple different questions, Brittany. You started this with these are tough conversations, but yet the way you just laid all of that out for us felt very, you were saying it from your chest, like you've done this thing before. And I guess I'm wondering, how do you get past the uncomfortableness of having those tough conversations?
Oh, well, I like to kind of practice them out and kind of remind myself, well, this is the worst that could happen. Obviously, they're not going to say, well, you're crazy and you're never going to make that much. Generally, when you're at the point when you're negotiating a salary, either an offer's been laid out to you and they're not going to retract that offer because you gave them a crazy number. They're just going to say, this is the most we can do. If it's during the interview, and they're trying to work out a salary and you give them too big of a salary, if they really like you, they're still going to give you an offer. It might just be lower than what you said. Um, they're not, if they really like you, they're not going to be like, oh, well, we can't offer her the job because her salary was too high. They're going to still try to get you. So I do like to just remind myself, well, that's the worst that could happen. They're not going to tell me I'm crazy or anything bad. Um, I also like to network and know people that work at all of the big social work agencies in my area. I pride myself at knowing different social workers all around my town, and I'm not afraid to reach out and be like, girl, what are you making before I go in the interview?
And what are those conversations like? Because one of the things I think we kind of all been raised up on is you can't talk about your salary, right? And I think that is why some of these organizations have been able to lowball us because we don't talk about salary. But here you are being bold and calling your social work colleagues up and saying, hey, what are you making at this job? I'm thinking about applying. Have folks been forthcoming and giving you that information and been okay with sharing their salaries with you?
Yeah, I think there's definitely like a generational gap in that because I know some of my older social work friends, when I've asked, they've been like, oh, well, I make a good amount. I'm like, well, can you just tell me if it's in between this range? And I'll usually give them like the lowest I'm willing to take and like then 5, 10,000 more than that. And they're generally say like, yeah, you're good asking for within that range. But I do think, like I said earlier, there are some social work positions that are offering like $15 an hour. And I think that that's inappropriate. And if that's all they're willing to pay, then they need to budget for a different position and get that figured out amongst themselves. And the only way we're going to change that is if we discuss our salaries amongst each other so that nobody feels willing to accept that low of a salary.
I completely agree. Completely agree. Brittany, you talked about, only one position saying, no, we can't match that or give you what you were wanting. I'm curious, like, some people really want a position and are looking for a job. And then if they say, this is what I'm willing to take, and it's way too low, then they're really disappointed about not being able to get that. I'm wondering, like, were you disappointed when that job was not able to offer you what you wanted? And, how did you move on from that?
I was very disappointed for sure. I think one of the reasons I was so confident in being able to say, like, I'm not taking it is because I was secure in the job that I was in. I was okay with it, and I was still shopping around. And I knew at that point, like, I could continue to shop. I definitely have been in positions where I've been with companies that I'm like, I absolutely cannot stay here another week. I'm willing to accept anything as long as I can live off of it. Um, I'm okay with taking a job temporarily. I don't think there's anything wrong with that. Experience is always good. I think there have been a lot of places when I've worked in that other social workers have been like, well, we deal with the unfortunate situations that we're put in here because we're paid so much. And then I've also been in really great places that I've worked in where they're like, we have to accept the lower salary because we work in such a great environment. And I hate that. I like just having I'm in a good situation now. I have a very neutral work environment. It's very safe and they pay me awesome. So that's what I want for myself, if that makes sense.
Oh, it makes absolute perfect sense. The best of both worlds in a safe environment and being paid for that master's in license that you worked so hard for. Absolutely. I love that answer. Thanks, Brittany. I'll move on to my second question. As the NASW has shared in its press release for Social Work Month, social work is one of the fastest growing professions in the United States, and that we are on the front line for some of the toughest crises this nation has faced. Can you give me an example or examples of your frontline experiences? And what advice would you give to social workers who are about to enter the field?
Yeah, of course. So me personally, I work in the field of health. I'm a medical social worker right now. So when I think of like frontline work, I think of post pandemic. And, during the pandemic, I was a brand new social worker. I was kind of serving for people with disabilities. I would make what we would call face sheets. So I would write out on these face sheets like what their disabilities were, what their triggers were, if they had any different religious beliefs, like what treatment they would and what treatment they would not accept. Um, Basically like a general outline of everything that somebody would need to know about the person I was representing, that they could read in 5 minutes to make sure that those people had somebody to advocate for them in the hospital, even though nobody could be with them, which was like our biggest fear ever. And that was a way that I served kind of in the front lines. Now being post pandemic and working in a hospital, we're seeing a lot of different health effects that are coming from people like post having COVID, like the rate of diabetes, type 1 and type 2 being diagnosed in young people has gone up drastically compared to those who have never had COVID before. And with that, I like to stay educated on what advice and what knowledge I can give to people receiving a new diabetes diagnosis, and then what extra resources that I can provide. Is there any home education? Are there any support groups nearby? It's a lot being found in like younger adults and kids. So I also think about education for parents too. And that's just one of the things here lately. We're also seeing a lot of people with eye damage, losing vision early. So that it's super important to find different resources for those people as well. And it's also really scary to hear that your vision might not come back. So I always like to just be a support to those people. I let the doctors and the nurses know I'm here. I'm always available, even if it's just to sit with somebody while they're receiving bad news. I'm here. Call me. So those are some of the ways that I serve in the front lines.
I'm wondering too, as we are serving on the front lines, Brittany, and all of this is new to all of us, right? We just all have all been in a pandemic together, and now we're coming out of it and realizing, like you said, there's some long-term effects that are people are experiencing. How do you take care of yourself as a person who was also in the pandemic, but then now seeing this diagnosis, these new diagnoses coming in for a new demographic that we've never seen before? How are you taking care of yourself and all of that?
Um, well, I like to stay educated on it, and I stay messed up with all my gear on in the hospital. I make sure to read thoroughly what is going on with the patient before I go in and talk to them. You can't always rely on those hazard signs because they're not always there. So I like to read, I like to ask, I keep my mask on, I wash my hands, and I know what signs and symptoms are to protect myself and the ones around me for sure.
Love it. Good job. Good job. Great answers. Finally, you're going to be an LCSW or LICSW for us in the next year, the highest license recognized by this profession. With that license comes an energy of leadership. How do you see yourself as an agent of change within our profession, and what changes would you like to see happen in social work?
Okay. Well, I love training people and teaching people. I am the first one to volunteer to do different trainings. So I would love to be able to apply myself as a supervisor or an educator sometime in the near future. I move around a lot, and that's not even with the travel job. I just don't know where I want to stay. So, whenever I do move, I always like to research what schools are around me and what programs are around me because a lot of social work programs now have different specialized programs. So, I like to see what the specialties in my area are to see, like, could I apply myself as a teacher in that program? I definitely want to be a supervisor though, because I love sharing what I know and hearing what other people know and helping people grow. Um, as far as what changes I would like to see happen in the social work field, I've been thinking about this a lot lately as a travel social worker. I would love to see a compact license come about. With that, I know I've learned I'm licensed in a couple different states, and every state has its own unique requirement. And something I know from like New York and California, they come with their own education requirement. Like I know for California, it's like 18 hours and similar for New York. And I've done the education for New York, and I know that theirs is very specific to New York's history and the different things that have happened there that they think it's important for social workers to know this history so they can know how to treat our population. Um, I think one example was with the Willowbrook State School there, which was a really traumatic thing that happened there. For me as a social worker, when I got one of my jobs there, they told me, you are going to work with clients who lived through Willowbrook, grew up there, and now they have associated traumas with that. And being told that, I was expected to know how to treat those people and what their reactions might be like. Um, and that has helped me a lot, even being out of New York. That knowledge of that took place has helped me with my jobs working with people with disabilities from in other states. Because if it happened in New York, similar things I'm sure happened in other states. I'm not sure what the specific requirements are when it comes to educations in other states, but I think if there was one general class, and I'm sure it would take a year to complete the class, but that said, these are the specific teachings that each state wants you to know. I think that would be so cool to take. And then maybe then there could be like a LCSWC for like compact. Like I've taken all the trainings for all 50 states and I'm confident in practicing in every state. So that's what I would like to see one day. I think that would be super cool.
Brittany, that is such a great idea. I love that you brought up the Social Work Compact because I'm actually doing a podcast interview with Dr. Lauren Richardelli and Alexandra Phillips coming up really soon. So I would love for you to, listen to that. But I'm also going to share your idea of this state national education per state of what can social workers learn about each state that's specific to that state. I even like your C behind the LICSWC. That is such a great and unique idea. And I'm also going to send you some reading materials that they've shared with me since you love to read. So that we can all educate ourselves on the social work compact because there are some legislations that are out there, and we want to make sure that it's all in the best interest of social work and not just for the policymakers, right? So that was a great idea, actually, Brittany. You're so innovative.
Oh, thank you.
Yeah. Well, Brittany, thank you so much for coming on and on this special episode of the Goddesses of Social Work podcast for Social Work Month and talking about the salary gap and inspiring change. Um, Really just a great interview. Thank you.
Oh, thank you. I had so much fun. I loved your questions.
Yay.
Thank you for listening to today's episode of the Goddesses of Social Work podcast. We are glad you were here. If you liked this episode, please come back to hear more stories of the journeys through social work, and please leave us a review on Apple or Spotify. See you next time here on the Goddesses of Social Work podcast.